Where is the proof that long-term exposure to small wireless communication facilities will have absolutely no effect on babies, children, and our delicate ecosystem? Do you know? Because I certainly haven't seen it. What I have seen is thousands of people worldwide suddenly and unexpectedly becoming sick after levels of radiation in their environment increased, often without their knowledge or consent. So these are people who are getting sick and not knowing why, and then discovering something has changed in their environment.
Today I'm going to show you what I have discovered through my researches. I'm big on Facebook, so I post my researches on Facebook, and I wanted to make a video about it, but I wasn't able to figure out how to. So it took me a long time, but I just wanted to share it with you too. If you haven't watched my previous videos about the germ theory and then also exosome or terrain theory, Dr. Thomas Cohen, this one is good, and the alternate theory by Thomas Cohen, and a fallacy of germ theory. You don't have to watch all of them, but if you haven't, then I suggest you to watch one of them, because I'm an EMT, ride ambulance, so I can see COVID patients, so I know this is not just a flu. It's not, and some of them seem like they're having flu, severe flu, but some of them are not. That's why I have been researching about this to make it sense. I just wanted to share information with you. I want to emphasize why I don't think vaccination is necessary. If you're interested in, please do more researches. If you find anything else, then please let me know. I would like to know. Alright, let's begin. Since coronavirus reached Japan, which is my country, in January 2020, I have been closely monitoring this pandemic because I'm an EMT and I have to deal with COVID patients too. Some of my friends told me, gee, you need to look at 5G. I wasn't sure if it was 5G because I couldn't tell anything. I didn't know much about 5G at that time. When COVID hit United States and then came to the state that I live, one of the small county became a hotspot. This is the city, Metro Atlanta. The small county became hotspot. I was wondering why. Maybe someone traveled to here and then it spread, but it just didn't make sense. So I try to see what's going on. This is the county. This is the metro area. It was probably from late March or April. Well, it says April 4th, so April number. Their cases are next to the metro area. And I was just curious, so I typed 5G in the name of the county, and then boom, 5G wireless communication technology to come to Albany. That was September 2019. So they rolled out before other big city rolled out. So that made me interested in, then started digging into more and more. My coworker showed me the CT scan X-ray of COVID patients' lungs. Then I started digging into a little bit and then typed radiation injury and then found radiation pneumonitis. I'll show you an article about radiation pneumonitis on Healthline, which is very popular. Okay, this is what is radiation pneumonitis and then how is it treated. Radiation pneumonitis is a type of lung injury, while pneumonia is caused by bacteria or viruses. Pneumonitis is caused by an irritant similar to an allergy. Radiation pneumonitis happens to some people after they have received radiation treatments to their lungs and chest area. So what are the symptoms? Main symptoms are shortness of breath, dry cough, feeling of fullness in chest, and then flu-like symptoms. Boom. Same as the symptoms of coronavirus. How is it diagnosed? Chest X-ray, chest CT scan, and then chest MRI scan, and pulmonary function test. These are the same tests that the hospital used with coronavirus. Well, patients who had coronaviruses. And then at the beginning, they didn't have a PCR test. They used these test methods to whoever had these symptoms, right? Risk factors, of course, receiving higher doses of radiation, but having poor lung function prior to treatment. So people who had COPD and smokers, or smoke is a risk factor, but these people who have those conditions were vulnerable to coronavirus. Being female, well, COVID affects everybody, so forget that. But being older, and official narrative says older than 65 is also vulnerable COVID, right? Okay, it's same. This is the article from Radiational Therapy and Oncology. Okay, I found this. COVID-19 and radiation-induced pneumonitis, overlapping clinical features of different diseases, which means basically radiologists and an oncologist were claiming that the symptoms and then also the conditions between COVID-19 and then radiation-induced pneumonitis are similar. Right? Now you have to purchase this article, but I think I have it somewhere. And so these radiologists researched patients in Wuhan, patients in New York and in LA, and then found these similarities. Okay, if I find, I'll link it later. It might be this one. Okay. Yes. Okay, this is the article. So I'm gonna post this link so you can look if you want to. And also it shows the chest X-rays, CT scans also, so you can compare. Also it shows references so you can look at. This is another thing. Okay. After that, this is published on May 5th, published by Doctors Need for Caution in the Diagnosis of Radiation Pneumonitis during the COVID-19 pandemic, because I told you all already, but the symptoms and conditions are almost exactly the same between radiation pneumonitis and COVID-19. And next, so this is another thing that I found. All right, this was from a local CBS News.
Health organization says most people with mild cases of COVID-19 should be okay again within 2 weeks. But thousands of patients are experiencing serious physical and mental symptoms months after they've apparently recovered from the disease. They can include fever, vision problems, burning skin, exhaustion, hair loss, brain fog, and shortness of breath. It's unclear how common this is.
They say that these symptoms, aftermath symptoms, all right. Let's review. High fevers, vision problems, burning skin, extreme exhaustion, loss of hair, brain fog, shortness of breath. It sounds familiar, doesn't it? I left a comment, and interesting, those symptoms are same as the symptoms by radiation. Yes, they are very, very similar. I'm not concluding anything, but I just wanted to show you, all right?
Studies show COVID-19 patients may experience lingering symptoms from lung, kidney, heart, brain, and nervous system damage caused by the disease.
They left the hospital because they were well enough to get out of hospital doesn't mean that they're healthy.
Dr. Mafazur Rahman leads a post-discharge clinic for COVID-19 patients at SUNY Downstate's Brooklyn Hospital. The clinic taps into different specialists to help patients recover and learn more about the disease.
This COVID-19 involves the brain, the nervous system, the skin, the kidneys, the heart, the lungs, the GI tract.
It sounds like the message you're saying is just because you've survived COVID, you are not out of the woods. There may be long-term lingering effects on multiple different organ systems.
Yeah, I mean, absolutely. Patients may have lingering side effects that is not apparent yet, but it will be apparent a few months, few years from now.
All right, let's look at the side effects of radiation. I'm going to go through Canadian Cancer Society and so side effects of radiation therapy. General side effects of radiation therapy: fatigue, skin problems, and hair loss, loss of appetite, nausea and vomiting, low blood cell counts, and side effects of radiation to the brain: skin problems, hair loss, and seizures, headaches, nausea, vomiting, loss of the cognitive problems, which is brain. Okay. Side effects of radiation to the head and neck: skin problems, hair loss, taste change, and radiation to the chest: skin problems, hair loss, sore throat, and taste changes, loss of appetite, cough, radiation pneumonitis. Okay, to the abdomen, here we go, and diarrhea, stomach ulcers, bloating or gas. Recently, the official narrative was adding that one of the symptoms of COVID-19 is a GI problem. So here you go. And then kidney problems, of course. Late side effects: heart problems, lung problems, skin color, mental or emotional problems. And if you look at the EMF radiation injuries, you can see all of these too. All right, let's go to the next one. I was listening to a podcast about 5G, and this man was talking about how people get affected and then get sick by 5G. And one of the symptoms that he was pointing out was hypoxemia, like a high altitude sickness that will cause symptoms like carbon monoxide. And then Dr. Cohen, Thomas Cohen, I posted a couple of his videos before. He was also talking about a doctor in New York explaining the conditions of COVID patients. And then he was saying that he sees high altitude sickness like symptoms.
This is Dr. Cameron Kyle Seidel, ER and critical care doctor from New York City. 9 days ago, I opened an intensive care unit to care for the sickest COVID-positive patients in this city. In these 9 days, I have seen things I have never seen before. In treating these patients, I have witnessed medical phenomenon that just don't make sense in the context of treating a disease that is supposed to be a viral pneumonia. 9 days ago, I presumed I was opening an intensive care unit to treat patients with a virus causing a pneumonia that was ravaging lungs across the world, starting out as something mild, cough, a sore throat, and progressively increasing in severity until ultimately ending in something called acute respiratory distress syndrome, or ARDS. This is the paradigm that every hospital in the country is working under. This is the disease, ARDS, that every hospital is preparing to treat. And this is the disease, ARDS, for which in the next 2 to 6 weeks, 100,000 Americans might be put on a ventilator. And yet, everything I've seen in the last 9 days, all the things that just don't make sense, the patients I'm seeing in front of me, the lungs I'm trying to improve, have led me to believe that COVID-19 is not this disease, and that we are operating under a medical paradigm that is untrue. In short, I believe we are treating the wrong disease, and I fear that this misguided treatment will lead to a tremendous amount of harm to a great number of people in a very short time. As New York City appears to be about 10 days ahead of the country, I feel compelled to get this information out. COVID-19 lung disease, as far as I can see, is not a pneumonia and should not be treated as one. Rather, it appears as some kind of viral induced disease, most resembling high altitude sickness. It is as if tens of thousands of my fellow New Yorkers are on a plane at 30,000 feet and the cabin pressure is slowly being let out. These patients are slowly being starved of oxygen. I have seen patients dependent on oxygen take off their oxygen and quickly progress through a state of anxiety and emotional distress and eventually get blue in the face. And while they look like patients absolutely on the brink of death, they do not look like patients dying of pneumonia. I have never been a mountain climber, and I do not know the conditions at base camp below the highest peaks in the world, but I suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate. I don't know the final answer of this disease, but I'm quite sure that a ventilator is not it.
As a truth seeker, I usually don't follow any doctors or anyone who go viral because somebody has to push them to go viral. But and then also this microphone is professional. I have a nurse friend, and my coworker works at the hospital, and another friend who's EMT and working at the COVID center. They all tell me that people start suffering, all of a sudden collapse, and then start having hypoxemia. I have had patients who had hypoxemia, O2 saturation goes low, and then without oxygen it just keeps dropping, the number keeps dropping, so I know this is happening. So I used this video, and then I wanted to show that it's not just the flu, but there is something going on, and then I wanted to use this doctor's statement. So I started digging into to see if radiation can cause carbon monoxide, and I found something. Alright, this toxicologist named Albert Donate reviewed cases in Wuhan, and then found that some of the severe cases in Wuhan were showing that endogenous carbon monoxide symptoms. He was saying that if that's the case, the patients whose O2 saturation is going down, patients who are suffering from hypoxemia, their treatment is not going to be a ventilator, but hyperbaric chamber. Some hospitals started using hyperbaric oxygen therapy, which is hyperbaric chamber, as a treatment for COVID, severe cases of COVID, and then started working. So endogenous carbon monoxide happens when that is caused by cell toxicity. Just thinking, one dead virus from Wuhan, China, travel all the way to United States or wherever, and started spreading, and then making cells in your body deteriorate in a matter of 2 weeks, and it just doesn't make sense. But research this a little bit too, and then see what the endogenous carbon monoxide is. What is endogenous carbon monoxide? The majority of endogenous carbon monoxide is produced in a reaction catalyzed by the enzyme hema-oxygenase. Carbon monoxide functions as a signaling molecule in neural system involved in the regulation of neurotransmitters and a neuropeptide release, learning and memory, and an odor scent response, adaptation, and many other neural activities. So it makes us a hemoglobin not attaching to oxygen, so oxygen doesn't flow in the body. Then that makes you hypoxic. Endogenous carbon monoxide concentration in blood elevates in acute coronary syndrome of a non-smoker population. Okay, so I found a study from Fukushima. It was 2015, and they found some non-smoker population who were having endogenous carbon monoxide, and in those patients were having a heart disease. Men don't smoke, but they were having a cardiac problems. And I thought it was interesting because it was like 2015. It was in Fukushima. And Fukushima was well known for radiation leak after the earthquake and tsunami. So the study shows that they monitored 235 patients, non-smokers, actually, who they went to ER for chest pains, and then they enrolled to this study. But they're non-smokers and developing blood clots and hypoxemia. Okay, so it's very, very similar to the symptoms of severe cases of COVID. We have learned that the similarities between COVID and then radiation-induced pneumonitis and endogenous carbon monoxide, but how does it happen? COVID, I heard that the COVID virus causes cytokine storm, how COVID-19 induces cytokine storm. So I looked up to see if radiation causes cytokine release also. And here you go, cytokine release syndrome after radiation therapy. So whenever our body receives radiation, the body starts showing, releasing cytokine. I guess this is the terrain theory fills in. Our body starts trying to detox, and the cells releases toxins out. This is what it is. And next, also the official narrative says COVID or coronavirus attacks ACE2, ACE inhibitor, attack it and then goes into your body and then spreads out. That also happens with radiation too. Also, radiation or EMF, an electromagnetic field, acts like calcium channel blocker. If you type, you can also find that people on calcium channel blocker medications for blood pressure or diabetes, and those has something to do with PCR tests. I cannot explain that one well, so I'm gonna leave it out. But if you're interested in, or if you know about this, please educate me about that one. So we all know that as a COVID test, RT-PCR test is used, and I posted a video about RT-PCR test is used also to evaluate the RNA sequences to create new medications for cancer or even insulin. The symptoms are the same, conditions are the same, what happens in the body is the same, and test is the same too. And recently, they started selling a rapid test that you can poke your finger and then get a little bit of blood and then test to see if you have antibodies in your body for the COVID, and that shows miRNA. So this new test checks differential microRNA expression in the peripheral blood from human patients with COVID-19. So that's what they are looking for, microRNA expression. Okay, and so again, I typed radiation in blood test, then microRNA, and I found this from Science Daily. New blood test quickly reveals severity of radiation injury. Boom. And then in a search for such biomarkers, investigators focused on microRNA or miRNAs. There are tiny RNA molecules first identified about 20 years ago that help regulate gene activity. So they are made in cells, but some microRNAs are found in the bloodstream, and then the scientists asked whether varying doses of radiation might cause corresponding changes in mRNA in the blood. So they say that they are testing for virus, but to me it sounds like they're testing the level of radiation injury in your body. Okay. What causes endogenous carbon monoxide? It's air pollution, in radiation, in also military weapon. I found the article about it, but somehow it's gone. So I'm not sure where it's gone, but it's just, radiation can cause endogenous carbon monoxide. So we want to know it, okay? And this one is the map of US, of course, been in, this was like November COVID situation in October, November, that time. Military weapon also can cause endogenous carbon monoxide. So that's what I saw on the article, but it's gone. So I'm going to explain. So I attacked military bases in the United States. I can't say it matches exactly, but it's hard to tell. And then Wuhan, I don't think they have a U.S. military base in Wuhan, but South Korea had a lots of COVID early on, and then they have a U.S. base. And these are in New York and in L.A. definitely have 5G. So I'm not concluding anything again, but 5G increases EMF, electromagnetic field, and then that can cause strong radiation. Everybody knows that Trump administration was pushing a drug for malaria called hydroxychloroquine. Azithromycin, which is antibiotics, can help treating COVID patients, right? And one of my coworkers' wife works at the ER also, and she told him, and he told me that one of the doctors at ER was telling her or everybody that hydroxychloroquine works. So it's gotta be something. Then I typed what hydroxychloroquine is used for besides malaria. Boom, radiation-induced injuries. Okay, here's some studies. Azithromycin attenuates acute radiation-induced injury in mice. They use mice for almost everything, every drug. So we can't say that this one doesn't work for any particular drug. But here you go. In hydroxychloroquine radiation and temozolomide treating patients with newly diagnosed Glioblastoma, Multiforme brain tumor. It's here. Repurposing Drugs in Oncology, chloroquine and hydroxychloroquine as anti-cancer agents. This one, here you go. There is a study, and you can read it if you want to. I put all the links in the description. And then when I was researching this one, I came across with a drug called TP508, which is known to stop radiation injury. And now NIAID is funding a study to monitor if this drug works with COVID-19 patients. Here is a study. It's a market watch. Sorry, not found. I should have copied a screenshot. Okay, and drug can stop radiation poisoning up to 24 hours after exposure. Yes. Okay. This is from 2015. Okay, this shows a new drug called TP508 was originally designed to help patients regenerate cells by increasing blood flow and then decreasing inflammation, according to the press release. It's been used to ensure that diabetic patients don't lose a foot, or to help patients with wrist fractures heal more quickly. In this study, the researchers exposed mice to acute levels of radiation, then gave them an injection of TP508 after 24 hours. Not only did the drug prevent the destruction of the intestinal barrier cells, it boosted biomarkers characteristic of cell repair. So, yep. And also zinc. At the beginning of this COVID thing, our medical director sent us an email saying that the zinc works, to prevent, so we should take zinc. Well, here goes in biokinetic model for zinc for use in radiation protection. So zinc also protects your cells from radiation. Here's like a TP508 for COVID. Let's see, TP508 for COVID-19. So that was the study, actually. I'm sorry. Check. Yep. So they tried to see if TP508 works with COVID patients, and here you go. There it is. All right. And it's just the matter of how you find the studies and articles, and then just connect dots to the research. I have been trained by Dr. Pam Popper. She calls herself research guru. She teaches us how to research. You can't just research through reading from the studies and articles on the first page, but you really have to dig into to find something to debunk official narratives. So I guess I learned that method and then implemented to this research, and then here you go, find everything. I want to mention one more thing. Some of the severe cases of COVID patients receive blood transfusions to replace hemoglobin, and of course they when you type hemoglobin replacement for radiation injury, then you can see all the studies talking about the importance of hemoglobin for radiation therapy. So it connects this one too. Okay, I want to talk about him real quick. This is Professor Martin Paul of University of Washington. He has been researching about 5G EMF, and he's been warning the world the danger of 5G. So he's also claiming that 5G COVID is 5G. So if you are interested in, I'm gonna put the link in the description, so please look at this one, and I would recommend you to watch his videos on YouTube. You can look up Martin Paul, then you can find some videos. Lastly, I introduce you to this Nuclear Emergency Tracking Center. You can only see the map of United States and in Japan, but they update the level of radiations pretty often, like every hour or every few hours, so you can look up. Today, they don't have any Radicon 4. I have seen pretty bad radiation level almost every day, everywhere. I have been listening to professors or engineers' interviews or conferences about 5G or danger of 5Gs, and then I have learned about the danger of EMF. I presented all the facts or similarities between COVID and then radiation injuries. So it's up to you if you believe my researches or not, but either way, we live in a very toxic world, so we really have to to protect ourselves. So one day I'm gonna try to make a video about how to protect our body, then minimize the threat from these radiations or COVID. Okay, that's about it. I hope you enjoyed this presentation. If I find more stuff, then I will update the video again.